Welcome, everyone, to today's lunch seminar. Thanks so much for being here. My name is Dr. Tina Kempin-Reuter, and I'm the director of the UAB Institute for Human Rights. I'm very excited to welcome you today for today's webinar on public health from a disability perspective. Today's webinar is made possible by the Office of Public Health Practice, the Public Health Student Association, the Lister Hill Center for Health Policy, and the Institute for Human Rights. Each sponsor is offering virtual events throughout the semester, so check out our websites and social media for updates. All right, let me introduce our amazing speaker for today, Ms. Elizabeth Patton. Ms. Patton is a program coordinator with Disability Rights and Resources. She has over 15 years of experience working in the disability field, with 12 of those years in direct service positions. She has spent the last 5 years building a cohesive independent living program at Disability Rights and Resources. Her aim is building a strong disability pride community to increase capacity for advocacy. As a person with a disability herself, she has seen the power of a strong community can create on an individual level and at a systemic level. Ms. Patton has a bachelor's degree in sign language interpreting from the University of New Mexico and a certification in nonprofit management from the University of Montana. She currently lives in Moody, Alabama with her husband and son, and likes to say that she wasn't born in the South, but she got here fast as she could. And the same is true for the independent living movement. Thank you so much, Elizabeth, for being here, for taking time out of your schedule to talk with us at UAB.
I am so very excited to be here with everybody today. It's rare that you get the opportunity to kind of nerd out, I guess, let's say, on some topics that really interest you. And so my topics are definitely the independent living movement, public health, and just being a person with a disability. I am a middle-aged white woman with brown curly hair that goes a little bit below my shoulders. I am today wearing a white shirt with black embroidery at the shoulders and the collar. My pronouns are she and her. And if you can see, my background is blurred. What you cannot see back there is the cat tower and just kind of my home. So that's why it's blurred out. I hope everyone is good today. On the screen, you'll see a picture of the building I work at, which is Disability Rights and Resources. It has a green awning. The logo you'll see on the left-hand side of the building and in the center, that's a shield. Which indicates that we're here to help protect the rights of people with disabilities. The power of hope and freedom is our tagline, and you can see that on the screen. We are so proud to be right across the street from the Civil Rights Institute. It's a big belief of ours that disability rights are civil rights, and so we specifically chose that location. We are a United Way funded agency. Today I'm going to go over a lot. So like I said, I'm really passionate about this, and I appreciate the time to touch on all of these topics, including the independent living movement, where we've been, and kind of this resurgence that we're seeing in the independent living movement and what's coming next, because I really believe that it's going to be public health focused. Disability language, how we talk about disability, barriers to public health as people with disabilities, and then specifically my agency, Disability Rights and Resources, and how our wonderful staff are kind of approaching the public health questions that we have. I've got a quote on the screen. It says, "Disabled voices need to be uplifted so society can be more inclusive overall." And that's a quote by Kelly Moe. If you take anything away from this presentation today, if in 5 minutes you kind of space out and you go get lunch, whatever, if you take nothing else away, I want you to take away that we need to start centralizing disabled voices, and in particular, those of our most marginalized disability communities. We need to really be listening to the people with disabilities, and I say their voices need to be uplifted, because that idea that we give voice to the voiceless. People with disabilities are not voiceless, right? We have a voice, it's just not being listened to. And so we need to center that and really listen to those voices. The independent living movement postulates that people with disabilities are the best experts in our own needs, which is why we need to be listening to them more. and us more. And so therefore, we as people with disabilities need to take the initiative to collectively design and promote better policies, processes, environments, and organize ourselves for political power. It's kind of the independent living movement philosophy. The independent living movement, which began in the 60s and the 70s, says that people with disabilities are entitled to civil rights, options, and control over the choices in their own lives. So we have choices that we get to be able to choose things in our own lives and not be spoken for and not have those choices made for us. The movement really comes from following 5 different other movements that were going on at the same time. Disability rights really owes some of what we've come from this idea of deinstitutionalization, civil rights, self-help, demedicalization, and consumerism. So deinstitutionalization is still our biggest fight. It continues to be our effort to move individuals with disabilities out of institutions and back into the community. So what that's referencing is there are folks in nursing homes, for example, who are there simply because of a disability, who are unable to move out and back to the community. And we'll talk a little bit more about that later, but that is a big part of our movement then and now. So the civil rights movement, people with disabilities really saw what was happening in the civil rights movement and said, oh my gosh, we share those basic issues. The disgraceful treatment as a result of bigotry and ableism and mistaken stereotypes in education and housing and employment. Their strategies are great, our strategies are great, and all of our tactics are very similar. So we owe a lot to the civil rights movement as an independent living movement. The self-help really comes from the, let's think about the AA movement, right? The idea of Alcoholics Anonymous. So people coming together as a group and helping and supporting one another. So people with disabilities believed then that it was more likely that they could assist and understand each other and help each other reach that independent living method. A lot of this came from, and we'll talk a little bit more in a bit on about camps. I don't know if you've seen the movie Crip Camp on Netflix, but movies like that, camps like that, where people with disabilities came together and found friendship and support. And then demedicalization, which is number 4, that's mostly about removing putting doctors on pedestals, right? And understanding that the authoritarian medical model is not always the only model, and that really individuals know and need to be responsible for what they need and defining themselves and meeting their own needs. So that move from you tell me to I will tell you. And then finally, the 5th one is consumerism. And I might age myself here. My mother was a big fan of Ralph Nader. If y'all know Ralph Nader, he was, big into the consumerism movement. And this movement basically said that consumers should actively question the services and the products that they're getting and the true motives of the corporate establishments that are providing those services. And so when you looked at all of these 5 areas together, people with disabilities came together and said, you know what? We know what we need, and we're questioning what we've been provided all this time. I'm going to go through this just real quick. This is the independent living paradigm compared to the medical paradigm. As you can see here, the definition of the problem from the medical model is definitely those physical and mental impairments. You are not whole, you need to be fixed. Lack of vocational skills coming from that kind of capitalist perspective. The independent living paradigm says that really the problem is that we're dependent on others. We're dependent on the professionals, we're dependent on the systems, we're dependent on the families. The locus of the problem, again, is the individual. Is they're broken, they're sick, they really need to fit into society. So that's been that model for so long, is that idea that as close as you can get to being normal is the best way to go about it, right? And the independent living, we posit that the environment, the barriers are really the problem, the societal barriers, attitudinal barriers, physical barriers. That's really the issue. It's not the disability itself. It's not the person who has the disability. It's what the barriers that we run into on a day-to-day basis. The solution to the problem in the medical model really is that professional intervention, treatment, those doctors and agencies speaking for people with disabilities. We're looking at how to get rid of those, the civil rights, the ADA, barrier removal, self-help, peer role models, and then again, consumer control. When you look at where does the person with a disability fit in our society, the medical model, they're usually seen as a patient or a client, or really that person who gets the chair on the other table away from the rest of the folks because they're different, right? So they're looked after, they're pitied. In the independent living idea and this new disability justice movement, we're looking more at the person with disability as not only a consumer and a user of services, right? So the person with a disability should get to choose. Do they want to work with my agency? Do they want to work with another agency? They should be able to go and just work with whatever company and agency they want to work with and not have to go through the disability field to do it. I think as we carry on in the disability justice type of centering, I think this will change to be even more the social role of a person with disability is just to be a citizen and just to be able to be a social person. Who controls the lives of the individual with disability? That's the professionals, that's the family members. We're looking at guardianship. Really, the people with disabilities don't have a say in their own life, really. There's always somebody kind of telling them what to do and controlling it. And then finally, the desired outcome. If you look at the left-hand column where it says medical paradigm, the desired outcome there is maximum self-care, basically meaning we want people to be able to do their ADLs, their daily living skills, right? So as much as they can do of that on their own, that constitutes an outcome. That constitutes somebody who's more, again, quote unquote, normal, who's following protocols in society kind of thing. And then also the vocational rehabilitation model of that would look at gainful employment. The independent living paradigm is independence through control over acceptable options. What that means is basically that the person with a disability gets to choose how they live their life. If it is easier for them to do their ADLs, their daily living self-care with an assistant, with a patient advocate or something, they should be allowed to do that. And that is an acceptable option. Living in the community with those supports is an acceptable option. So that's really the difference there. Real quick, I want to take you around some pictures of the independent living movement. I'm going to start in the upper left-hand corner. You see a picture of a white man in a wheelchair. Standing next to him is a Black gentleman with a guide dog. And in the background, there is what looks like a school building. This is Ed Roberts and Wade Blank, and they worked at Berkeley in San Francisco. Ed Roberts is amazing. So he is considered one of the founders of the independent living movement. He went to Berkeley, wanted to go to school. They said to him, and again, at the time, this is how they said it: we've worked with cripples before and it didn't work out. So no, we won't allow you to come to college. So he sued them and he was allowed to go to Berkeley. Now, he used an iron lung. He had polio, that was his disability, and he used an iron lung. And when he got to college, rather than put him in the dorm with the other students, they actually put him in the infirmary. So he lived basically in the student hospital with, in a hospital setting, just like in a nursing home setting with individuals that were not his peers. And more people wanted to start going to school who had disabilities, and they saw him as a role model. So they started going to school. Where'd they go? They ended up in the hospital with Ed Roberts. And what this became was something they called the Rolling Quads, which was this group of students with disabilities who lived together, worked together, schooled together. And again, that love and that partnership grew. And eventually he started the first Center for Independent Living in Berkeley. And when he was trying to get a job prior to college, the vocational rehabilitation department told him, you will never be employable. And so we will not take your case. And after he graduated and after he started the Center for Independent Living, he became the president of the state of California's vocational rehabilitation system. So that's Ed Roberts. To the right of that, you see an image of two women in wheelchairs. There's a microphone between them. They are speaking into the microphone. There's an American flag behind them. This is Judy Human is on the right. And the reason I added this picture is I want to point out that the independent living movement in the 60s and the 70s was the movement was really started by women. This was the first time that we had the LGBTQ population represented at a independent living movement, and they don't get mentioned very often. Is why I bring it up. Is that, as you'll see later on as we're talking, the movement, once it moved past this stage, really became more focused on basically white gentlemen, white men. And so I just wanted to point that out, that it was in the beginning very intersectional. And that's kind of what we're trying to get back to. So so Judy Human on the right, this is representing the sit-in to get the 504 regulations passed in 1977. In 1973, Congress passed the Rehabilitation Act, but they didn't put any regulations to it until 1977. So it was there, but there was nothing behind it. And the regulations went to the desk of Joseph Califanos under the Carter administration. And the people with disabilities, he refused to sign it. He kept sending it back with things scratched out and, I don't want to be spending this much money on it and this too many regulations, and really just kind of hacked at it and kept sending it back. Well, the disability movement, the independent living movement, went and did a successful sit-in, the longest sit-in and occupation of a federal building to date. More than 150 people with disabilities sat in on the San Francisco financial office for 25 days. They eventually successfully got him to sign the Rehabilitation Act regulations in 77. But there were 150 people with disabilities doing direct action, sitting in on, in there for 25 days. They were hungry. And again, they helped each other. So individuals who needed self-care, who needed care and attendance, were being provided it by, let's say, a blind individual was helping a gentleman with quadriplegia. And then in return, they were reading documents that blind individuals didn't have access to in Braille. So it built this cohesive, collective group that were pushing for power. To the right of that, you'll see a picture of the stairs leading up to the Capitol in DC. You'll see a gentleman in a Peace t-shirt and jeans crawling backwards up the stairs. In front of him is a man on his hands and knees facing forwards, crawling up the stairs. This was called the Capitol Crawl. Sorry, this was called the Capitol Crawl. Oh. It was a pretty cool time. There we go. So this is in 1990 when the ADA was trying to be passed. And again, the ADA there was a lot of pushback from religious organizations who said, we don't want to be a part of the ADA. We want to be an exception to the idea that we have to modify our buildings. The businesses pushed back and said it'll be too expensive to put in these, these accommodations. And again, what people with disabilities did is they went to the Capitol, they got to the bottom of the steps, they were mad, and spontaneously they decided to get out of their wheelchairs and crawl up the steps. They got in the way of senators, they got publicity, they were on TV, and it was very embarrassing, right? Can you imagine? And one of the things that I love is that they're really playing on that idea that people with disabilities need to be pitied. So you don't want to be the person on TV who is arresting people with disabilities, right? And literally picking them up and carrying them out. So they really played on that. To the right of that, we've got a picture from Alabama. This is about 10 years ago, I'd say. I just wanted to show this so if you don't know, we have a strong history of activism and advocacy here in Alabama. This is Dan Kessler, you'll see in the picture. He's in the upper left-hand side of the picture. He is the director of our center, Disability Rights and Resources, and he was there at the signing of the ADA. You'll see several individuals in this picture in wheelchairs. There's the Capitol behind them. This is from a nickel march. To the right of that is the nickel march, the very first one, where they've got the sign that says "Injustice everywhere is a threat to justice everywhere." we carry that banner every year in the Nickel March. And again, I think what we're coming up to is really a resurgence of that idea. In the lower right-hand corner, you see two Black gentlemen. One is kneeling down, one is in a wheelchair, and there's a window behind them. This is Bradley Lomax, or Brad Lomax. He was instrumental in the, if you look back at the Judy Human picture where they're sitting and talking into the microphone at the sit-in, he was a big part of that. And he was also a Black Panther. And so what I find, again, and what I find it fascinating about this time frame is that there was that intersectionality. And Bradley got the Black Panthers to use their food program to bring food into the federal building to feed the protesters in the 504 sit-in. To the left of that is a picture from Crip Camp. You'll see a bunch of people just having fun. Some are in wheelchairs, some are Black, some are white, some are walking, and it's just a group of kids having fun. If you have not seen the movie Crip Camp on Netflix, I highly recommend it. It is really it really is where we started, where the independent living movement started. And for me, it helps me to be able to explain to people where we're going. The final picture is a banner from Wade Blank. Wade worked in an institution with teenagers with disabilities, and through working with him, he discovered that what they wanted was TV and radio and to have fun. And so he started a program where they were living in what was normal, trying to be as normal of a dorm as possible. He brought up to the administration of the hospital that maybe they should look at living in the community. Maybe they could work together to try and get these folks out to the community. And he was fired for that. And he ended up starting the Atlanta Center in Denver, Colorado, as one of the first centers for independent living. Anyway, the banner reads "Free Our People," and it shows a person in a wheelchair, the typical wheelchair image, breaking the chains over their head. It says ADA, the Americans with Disabilities Act, to boldly go where everyone else has gone before. So I'm going to talk a little bit quickly about disability justice, which is the next phase in our history. So we talked about the movements that made up the Rehab Act, the 504 sit-in, the ADA. That's great, and we've got our disability rights. But disability justice is going to build on that, and that's what's coming. If you got your ear to the ground, you know that kind of disability justice framework is what is coming to build on that disability rights. So the disability rights, we established the civil rights for people with disabilities. The ADA is a civil rights law, and it changed the life for people with disabilities for the better. Students in college now have a better chance with disability support services. There are definitely more like paratransit is better. So there are definitely more opportunities that the ADA came. But we need to be honest when we say that the ADA is a law and it's founded in ableism. So really we need to look past that. The idea that when the ADA was established, who did the power go to, right? From Congress. So Congress passed the ADA, and then who was given that power? It was the people in the disability community who could assimilate the best into the normal able-bodied world. So that's kind of how that ableism and white supremacy type of mentality started out. And the disability justice wants to topple that on its head. The equality model, again, the civil rights model, looks at the symptoms, but not necessarily the root cause. So the idea that we can get into buildings because there are now ramps is wonderful, but the idea that the businesses still aren't automatically doing ramps and still have to be pushed to do ramps. Why is that? Really, the root cause is ableism. I talked a little bit about how it lacks the intersectional analysis. I talked about how the original independent living movement was very intersectional, but once the ADA was passed, it kind of dropped off, and well-meaning, mostly white, able-bodied people, or those that were trying to assimilate into the able-bodied world, really took the struggle, the disability struggle, and rights and justice, and really took it and made it their own. So they encouraged charity and pity and guardianship type of mentalities in the nonprofit world. They commodified disability bodies in the medical field. And then finally, in number 4, it's legal and rights-based framework, right? So we may have won the civil rights on paper, but in many ways, our existence is still treated as conditional. We're still asking for, please, can we have a seat at the table? Please, can we please follow these ADA laws? There's a quote from the Crip Camp movie: "The ADA was a wonderful achievement, but it was only the tip of the iceberg. You can pass a law, but until you change society's attitudes, that law won't mean much." And in this moment, with our pandemic, the pandemic and this disability justice uprising, it's so clear that our attitudes shape the laws, and how we are promoting ourselves shapes the laws, and then shapes our collective culture. And it really takes just a simple change of the mind, which is moving beyond just the individual legal rights to collective human rights. So the ADA was about individual legal rights. You could sue. These are your legal rights, and moving towards a more of a human rights type of mentality. So disability justice seeks liberation beyond the paternalistic equality-based systems. In fact, it seeks to dismantle them. The leadership of the most impacted, sustainable, intersectional, and interdependent, and the right to control our own autonomy. And what all of those bullet points mean is really we want to recognize the intersectionality of disabled people who belong to marginalized communities and center their voice even more than we center my voice or somebody else's voice. And those are like people of color, immigrants, LGBTQ, homeless individuals, incarcerated individuals, people who've had their ancestral land stolen. That's the leadership of the most impacted. Those are the voices we need to center, and those are the voices we need to be following. Because of this broader focus, if you look at the line where it talks about sustainable, intersectional, and independent, the disability justice movement is most comprehensive. The sustainable part is about the long term, right? We want to build long-term independence and long-term change for people. So this building it together is how we're going to make it sustainable and intersectional and interdependent. When another marginalized group gets rights, those rights help us as well, right? So we need to recognize that focusing on the sole identity of disability is limiting our potential. This is one of my favorite. You'll see the rest of the show has a lot of good comics and cartoons in it, like satirical cartoons. I went down a rabbit hole and found a lot I liked, and so I'm sharing them with you all. So this one is a picture of a woman, and she's sitting in a black leather chair, and she is on fire. She has long dark brown hair and a white jacket on, and she is on fire. And the news headline is, "HR manager spontaneously combusts in a strenuous attempt to avoid saying disabled." And it is from the Squeaky Wheel, which is a website with satirical disability cartoons, comics. I love this because I find people, we're going to start talking about disability language now, and it's one of my kind of pet peeves and also my passion topics. So people first versus identity first. Words matter. When we talk about how to speak about people with disabilities, it's people first means it's an objective way of communicating and reporting on disabilities. So it eliminates generalizations, stereotypes, and assumptions about the person with a disability, and it recognizes that they are people. So I will start with myself. I consider myself a woman with a disability. I have really great friends who consider themselves disabled women. But when I'm talking about myself not in this field, I'm a mom. I'm a, D&D fan, wine snob. Like I'm a number of other things that have nothing to do with my disability. And so recognizing that first and foremost, people with disabilities lead average lives. There is nothing fundamentally brave or resilient or special about us. That really, just starting from that point, when you're talking about disability, that just people with disabilities lead average lives. Never equate a person with their disability. So we're not talking about people using the R word. We're not saying, oh, that epileptic, oh, that autistic. I have really, really good friends who I've known for years who are well educated, who still say things like, oh, the wheelchair kid. So, I mean, that's just a simple way to start, is just never equate the medical term or the medical diagnosis with the person. People first language really starts with what the person has and not what the person is, right? So people first language is person with a disability, man with autism, woman with bipolar disorder. It gives dignity to the people with disabilities. Another good example is a man who walks with crutches, not the crippled man. Sorry, these are really hard for me to actually say out loud, some of these. And we want to avoid negative words that imply a tragedy. So suffers from, afflicted with, victim of. Again, being a person with a disability has hardships, and I would never lie and say it doesn't. But the idea that, I suffered with cataracts, it's just a viewpoint, again, that comes from ableism, right? The idea that sometimes when we have a visible disability, people will often come up and say, oh, I don't know how you do it. I would just die if I had that disability. It's coming from that place, right? It's coming from that place of being an able-bodied person who it must be suffering, when again, it's just a regular life. It's just a regular life and things that we are encountering. So that's people first language. I would love to answer more questions if anybody has any on those. There's a lot of different ways to talk about it, but I think the best way to talk about it is start with the idea that they are a person, the man with, the woman with, whatever it might be. Another good thought is to use, and I thought this was really smart, I got this from a research I was doing a few weeks ago, is the idea that the handicap, when you use the term handicap, it's an outdated term to talk about a person, but it is not an outdated term when you talk about the barrier. So the barrier is created by people, it's created by policies, it's created by the environment. The disability is a functional limitation that interferes with a person's mental, physical, or sensory abilities. So for an example, people with disabilities who use wheelchairs are handicapped by stairs, right? I want to talk a little bit about the resurgence of identity first language. So there is a huge movement, mostly among the youth with disabilities, to take back that identity and say that there is nothing wrong with the word disability or disabled. It is not a dirty word. Let's say it proud. And they consider themselves disabled women, the disabled community. There's a huge resurgence of this. And I do still know people that use people first language, but it seems to be shifting. And again, it kind of goes back to what I was talking about earlier with this resurgence of the disability justice community. The term bound, I did add that in there. The term bound is not one that we want to use. So wheelchair bound, homebound is the name of one of our waiver programs here in Alabama. The really bound, the wheelchair is a device that a person with disability uses to be free and to get around, right? So it's not, they're not bound to it. Like this, I'm not bound to my reading glasses kind of idea. Cutesy forms that avoid the disability altogether. This is kind of my where I plant my flag in terms of like special needs, or my personal favorite, disability, where they lowercase the DIS and then capitalize the ability part. Drives me nuts. Mostly because all of those terms don't come from the people with disabilities. They come from educators and parents who don't want to say the word disability. And I think that really does a disservice to our youth. All right, barriers to public health. This is another great political cartoon that I found. This one is from Britain, from the UK. It is a dialect from Doctor Who, and a label on top of it says disability unit. And in front of him is a gentleman in a wheelchair holding a paper that says feedback from disabled people. And the dialect is zapping it and saying exterminate, exterminate, exterminate. And the point of the cartoon is saying that there are so many units, disability units, and people focused on disability in public health that are not really listening to people with disabilities. And I think that's a really big place we need to talk about. The phrase to the left is nothing about us without us. The new statement really is nothing without us at all, but nothing about us without us. So if you are looking at helping people with disabilities and you don't have anybody with a disability on your committee, that's a red flag. My favorite, I'm going to talk a little bit about some examples of this in Alabama. During the COVID, ADPH began, they hired someone to kind of come up with ideas for how to help people with disabilities get the vaccine, get the correct information, all of that. They hired an individual who does not have a disability, has no background in disability, and they called her job title was disability champion, which I just don't even know how to even start explaining how wrong that is. That that the idea that people with disabilities need somebody to speak for us, right? Why not? And there we are. We're a group of advocates pushing for them ideas and for them to contact us so we can help. And they went out of their way to hire a disability champion. Nothing against ADPH. The fact that they have a disability champion at all is amazing and wonderful. And we have a great partnership with them, as you'll hear later. But again, that person doesn't have a disability. So they're coming at it from not from the true subject, right? Recently, one of our state agencies spoke with Governor Ivey. They passed I guess a resolution to add a seat onto their board of this state agency. The seat is specifically for a representative from an agency that represents people with disabilities. Again, wonderful, a step in the right direction. I would love to see every state agency have a person with a disability on the board. That'd be wonderful. But again, it's a representative from an agency that represents people with disabilities. And out of all the disability agencies in the state, I think I know of 3 or 4 that are whose director is a person with a disability. I know those only one is a person of color. The vocational rehabilitation is a great example. Again, I love vocational rehabilitation. I used to work for them. I loved working for them. But the idea that when you go to get a job, you need to have vocational rehabilitation's okay, or their backing, or them to speak for you in an interview is kind of where we're coming at. This image really talks about this whole last year. The disability advocates in the state have felt like we're screaming into a void, and it's just us screaming. It's not, and when I say that's just us screaming, that's us advocates screaming into the void. We need to start reaching those people with disabilities that we can't reach. I'm going to start talking a lot faster. I thought I put the slideshow together and thought I wouldn't talk as much. This is another quick couple of cartoons. The one on the left is a woman of color in a wheelchair, and it says disabled women are twice as likely to die from COVID. Around her neck, she has a tag, useless, burden, collateral damage. And there is a gentleman in a suit standing across from her. That is supposed to be Boris, but well, we thought, what's another label when you already have so many? On the right-hand side, you see a gentleman in a wheelchair and a gentleman who appears to be shaking, standing, and a woman handing out their labels. Nutter, again, remember this is from the UK, brave, burden, tragic. Come along now, one more label and you're ready to face the world, she says, and she works at the Department of Dependency and Care. I want to talk about a recent lawsuit that was dropped but was filed here in Alabama. When the pandemic hit, it became clear that in 2010, the state's plan, the Alabama state plan, during a crisis, a pandemic crisis, the last resort of hospitals, they were ordered not to provide ventilator support for patients, including children, with severe or profound mental retardation and severe traumatic brain injury. So think about that. When our hospitals were getting full during the pandemic, there were a lot, and again, it hit people with disabilities, people in nursing homes very hard. Parents, I know several parents who were concerned about their children, because if their children ended up in the hospital and there were no ventilators, that bias, that implicit bias, might say that a doctor would say, well, their life is not as worth somebody who does not have a disability. If you think about, let's say, a woman with Down syndrome, and she goes to the grocery store and she's on the swim team at Lakeshore, and she, has a part-time job and she loves her family and she has friends, who's to say that that is not a full and healthy life versus someone else? And that's where the implicit bias really kind of comes in. Is it's the not the things you say out loud. The implicit part is not the things you say out loud. It's what you see when you see a person with a disability. I think we need to redefine how health is discussed, because I think that it can be separate from the function part of a person, right? So if we say a disability is the impairs somebody's functioning, I think health can be looked at as more of a well-rounded balance in adapting to life's events. And this is really only information that the individual can provide, right? So again, looking at health from a individual perspective rather than kind of something placed on someone. I'm gonna go through this real quick. The housing, some of these areas that we see public health housing is a big one. So the Olmstead decision in 1999 stated that that the government should provide services in the community instead of nursing homes. So basically, somebody who lived in a nursing home should be able to choose to live in the community in the least restrictive environment. We are still struggling with this. There are housing vouchers. Accessibility in housing is a big issue. The Medicaid waiver program in Alabama, there are so many slots that aren't filled, but there are so many reasons why we can't fill them. The Nursing Home and Rehabilitation Act. One of our jobs at my agency is to help people transition out of nursing homes. There is data that is collected when someone goes in about whether or not they want to move to the community. But we aren't allowed to have access, or we do not have access to that data to help these people transition. People are turned down for Medicaid waivers when they could go into the community because they're not going to live with a person, not going to live with a family member. They're trying to move out into the community on their own. And again, that goes back to people with disabilities always need somebody speaking for us, taking care of us, and making those decisions for us. Transportation, again, another example from the recent pandemic. When vaccines were rolling out, suddenly agencies were caught off guard because people with disabilities don't have access to transportation. And the solution was to go check with churches. And I guess our argument is it shouldn't be a charity-based thing. We should have access to transportation. So again, we can go and do these things on our own and not have to worry about the stress of it. Isolation is one of the biggest ones for me. I think we don't know who has a disability out there. We don't even know the tip of the iceberg. The people that I work with and I see are individuals who are already disability advocates. There are people who have guardianships over them that we don't know who they are or where they are. There are people living in their homes who again, going back to that homebound, they're not bound. The bed gives them access to life, right? But we don't know how to reach them and we don't know where they are. So something I would love to see in the future, if anybody listening would love to partner with us, is to see some solid data done across the state as to where are our people with disabilities. The physical barriers, just a quick example of that. Women who experience mobility impairments struggle with getting mammograms because the machines are made for people who can stand up. Just physical barriers like that. Is there parking from the parking lot to where you're going? If you're an individual who has a mobility impairment, but you don't use a wheelchair, that's going to be tough. If you're an individual who has anxiety, how many stops are you going to have to make before you get to your doctor's office? Is it clearly marked? Are you going to have to ask questions? So a lot of those physical barriers. The cost, I cannot tell you just the cost. We talk a lot about Medicaid expansion at my office a lot because cost is so prohibitive. And then availability. So again, not only the availability of the healthcare itself, but like information. Are we making sure that that is accessible in plain language to everybody that needs it, in Braille, in sign language, and all of those things? But all of that together, right, comes from a public health disability justice lens. On the left-hand side of this screen, you'll see a picture of a bunch of individuals on the steps of our Alabama State Capitol. They are there for the Independent Living Advocacy Day rally a couple of years ago. You'll see signs that say, "Thank you." I see one sign that says, "Disability rights are civil rights. Independent living centers are great investments." This that just shows advocacy. In there, I have two missions. The mission of public health to promote and protect the health of people in the communities where they live, learn, work, and play. And the disability rights and resources, my agency, our mission, which is to empower people with disabilities to fully participate in the community. Those two match so well to me. When I started working on this and I put those together, I just thought, wow, that really, I think we should get some money from public health, because apparently we're doing public health. But no, they're just so closely interwoven. And I really think that the next chapter of the independent living movement is going to focus on public health. So how does my agency help? So my agency, our agency, which is Disability Rights and Resources, we do advocacy. We do that with one-on-one with people, which is self-advocacy. We talk about how to go talk to doctors, how to find the best insurance, and we work with other agencies to do that. There's community, there's city, state, and federal levels. There's protecting the civil rights of people with disabilities and preserving the ADA. Those are all the ways that our agency does advocacy. Specifically, we focus on Medicaid expansion, public health, accessibility, transportation, and nursing home transition. We have a focus on COVID-19. On the left-hand side, you'll see a picture. It's a woman in a wheelchair in a pink dress. She's got short red hair and green hoop earrings. It says, "Justice means a disability-centered response to COVID-19." We have a grant funded from ADPH that is designed to locate and educate individuals with disabilities on the vaccinations and accurate information about vaccinations and COVID-19. And we can also provide wraparound services for those who need to quarantine. If they have COVID-19 or a family member does, we can help with wraparound services, food, prescription costs, transportation costs. And then in addition to this, we're partnering, and ADPH is partnering with United Way's 211 system. Peer support is another, it's probably the hallmark of what we do. It's been a long time. Peer core service of ours is naturally integrated with how we work with people, which is independent living plans. The group setting allows consumers to talk about multiple perspectives. And one of the things that I would love for you all to do is go to our website, which is drradvocates.org. and go click on the "Can You Hear Us Now" video, which is an amazing video that AC Poteet, who's one of our staff members, created from a peer support group where we started talking about individually, we're not making enough noise about healthcare and public health. So can you hear us now when we're all talking at once? It's pretty cool. We called out a couple of other sills about it. I want to talk a little bit about our transition. We talked about nursing home transition. This gentleman on the right, his name is Jake Mitchell. He is a talented poet, a loving father, overall great person, and a person with quadriplegia who is institutionalized. He's been living in a nursing home for about 10 years. He finally found us, and we found him, and we've built a team around him. So now his team includes us, his family, his attorneys. He comes to peer support groups, and we're all working to help him transition out of the facility and back into the community. When I say helping him, it's all on him, right? It's all this is what he wants. We're just there to help support him in it. And we're in it for the long haul. So we are having a heck of a time getting his waiver, his Medicaid waiver approved to pay for in-home healthcare. And that's what he needs to move out. And so we're in it for the long haul. We're either going to help him transition if it's approved, or we're going to help him appeal it if it's denied. So we have a home modification program. We just received a large grant from HUD to assist with people able to stay in their community, which is and in their homes, which is a big public health issue, because we all know that going into a nursing home can affect you both physically and mentally. And we're able to go in and tailor modifications and home repairs with the help of an occupational therapist and registered nurse. We have a work incentives counseling program. I'm not going to read all of these, but just know that what they do is they help people who receive disability know about how going to work will affect their benefits, including health insurance, SNAP benefits, other things. But again, it goes back to that idea of let's give you the information. You see the picture there, the more you know, and we'll give you the information, and y'all, we'll be there to support you and make the decision. We are a member of the Southeast ADA Center. What that entails is we do a lot of work with the ADA around COVID specifically, but also shelters, and helping. We're here if you need any questions about ADA related requirements under public health. Real quick, and this is probably the second most important part. You see an email address at the top, nikki.watkins@drradvocates.org. The Alabama Disability Action Coalition, which was a brainchild of ours, is a collaborative partnership of Alabama agencies, organizations, and stakeholders. There's a whole coalition. There's a subcommittee of public health, and there's a subcommittee of poverty and injustice. It is open to anybody. You do not need to identify as having a disability, but the coalition does follow the voices of the people with disabilities. If you want to participate and you want more information, go ahead and email Nikki and she'll be able to get you the invite. It is every other Wednesday. So the two committees flop every Wednesday at 3 p.m. The last thing I have is it's one of my favorite pictures. I've got it on my window at work. It is a blue background with a woman of color in a wheelchair, electric wheelchair. She's got a white hat and a white dress, and it says the revolution will be wheelchair accessible. And I added the words and public health focused. The revolution will be public health focused. So we would love for you to join us in our kind of our advocacy and our activism. And I'm always here. I love this topic, so I'm here if you have any questions. Thanks, Tina.
Okay, thank you so much, Elizabeth, for sharing your insight. I know it's hard when you have so much to talk about in 1 hour.
It is, and it didn't seem like it was so. When I was typing it up, I was like, oh, that's not a lot.
Yeah, that's going to be quick. Yeah, I know. I know. Yeah. We have two questions that I think if you can answer in like 1 minute each, because we're almost out of time. So one is the question about caregivers, like how do caregivers fit within this advocacy and the disability justice movement?
Oh, that's a great question. So really caregivers can be asking themselves, what is it that the person with a disability wants? So really honing in on what their needs and their wants are. I think that is the best way to do it. And then finding yourself like a caregiver support group where you can talk about other caregiver issues so they don't get crossed over. So disability is one place and caregivers is the other. Perfect.
Thank you so much. The other question relates to this move from disability rights focus to disability justice focus, and whether how easy or difficult is it within the disability community to kind of make this shift?
It is incredibly difficult. So we need to look around and say, okay, what are we doing within, I'm just going to take my agency, for example, what are we doing within my agency that approaches these intersections? So we used to hold happy hour events, and one of them was racism and ableism. And the other one was like feminism and ableism. So we're doing those kind of events. It is really difficult. The leadership in our movement is not intersectional at this time. And we're kind of going against the powers that be and the powers that have been, I guess. Let me put it that way.
Well, Thank you so much again
Yeah.
for being here. And thank you all who attended today, also for your excellent questions and comments. If you have additional questions or comments, please contact one of us, like one of the sponsors, and we can happily put you in touch with Disability Rights and Resources, or with Elizabeth herself, if you, again, want to be involved in this important effort. And yeah, please do let us know. Thank you again, Elizabeth, for sharing your time and expertise with us. We really appreciate you being here. And we wish you a great afternoon, and hopefully you will be able to attend some of our future programs.
Yeah, definitely.
Thanks, everyone.